It started with something so small. Sarah thought it was just a sore muscle. She had taken a long car ride to visit her parents, sat for 6 hours straight, and by the time she got home, her left calf felt tight and achy. No swelling, no redness, just discomfort. She chalked it up to inactivity and got on with her week. School drop-offs, laundry, meetings, etc. A few days later, while folding clothes in her bedroom, Sarah suddenly couldn't catch her breath. She felt lightheaded. Her heart was racing. She sat down, but it didn't stop. Then everything went black. Her husband found her on the floor and called 911. At the ER, doctors delivered the terrifying news: pulmonary embolism. A blood clot had traveled from her leg to her lungs, blocking blood flow and nearly ending her life. And what if she hadn't made it to the hospital in time? And could it have been prevented? Today's topic is pulmonary embolism. Who is at risk, how it's diagnosed and treated, and additionally, at the end, I will share the latest research about the care for pulmonary embolus, and also I'll share and provide the list of my prevention tips. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. Why is pulmonary embolism is so feared? A pulmonary embolism can cause sudden death, brain damage from lack of oxygen, heart failure, or long-term breathing problems if not treated in time. So let's unpack this. What is pulmonary embolism? A pulmonary embolism, or PE, is a blood clot that blocks one or more arteries in the lungs. Most often, it starts as a deep vein thrombosis or DVT in the legs. That clot breaks loose, travels up through the bloodstream, and gets lodged into lungs, and sometimes with deadly consequences. And think of it like a traffic jam in your lungs. Oxygen just can't get through, so your heart has to work harder, and within minutes, your life is at risk. The symptoms can be subtle or dramatic: sudden shortness of breath, chest pain, especially when breathing deeply, fast heart rate, lightheadedness or fainting, coughing, sometimes with blood. Some people may only feel a vague sense of unease, like mild breathlessness or an exertion, slight chest tightness, or unexplained fatigue, making PE easy to overlook in its early stages. PE is a medical emergency, and unfortunately, it can strike completely out of the blue. So who's at risk? PE can happen to anyone, but the risk is high in certain situations. Prolonged immobility, car rides, flights, hospital stays, recent surgery, or trauma. Patients with cancer are at the higher risk. Hormone therapy or birth control pills. Pregnancy is another hormonal state that increases the risk of PE. Obesity, smoking, and clotting disorders. Some are inherited and some unknown. Sarah didn't know that she was at risk, but she had a common trigger: long immobilization and not moving her legs enough on that long car ride. So how is PE diagnosed? As always, we start with history and physical, but PE is tricky. It mimics so many other conditions. Tests for PE include D-dimer blood test, where elevated D-dimer levels can indicate a clot, CT pulmonary angiogram, that is actually the gold standard to see clots in the lungs. Also, an ultrasound of the legs looking for DVT helps. When it comes to PE, time matters. Diagnosing PE early can mean the difference between life and death. So now let's move to the treatment. For years, treatment meant hospitalization, IV blood thinners, otherwise called anticoagulants, and close monitoring. And the main goal of the blood thinner is to prevent the clot from propagating further and to absorb the clot. In the past, the hospitalization was relatively long because the mainstream treatment was anticoagulation with intravenous blood thinners. The main oral medication at that time was warfarin or Coumadin, and it took some time to build up its level before the patient could go home. Then it changed with the invention of low molecular weight heparin, such as enoxaparin or Lovenox, that patient could inject themselves, and that led to the decrease of hospitalization. Then more efficient oral blood thinners were introduced to the market, and that brings us to the latest research. A 2022 study published in a Journal of General Internal Medicine, followed 652 patients with confirmed PE who were seen in primary care, not the emergency room. The results were interesting. They found very low rates of hospitalization within 7 days, very few serious complications within 30 days, safe, effective care at home. And this aligns with the new American Society of Hematology guidelines, suggesting that home treatment is safe and preferred for low-risk patients, especially when direct oral anticoagulants are used. But here's the catch. You have to be sure that the patient is truly low risk. Doctors use several screening tools to assess 30-day mortality risk. All signs point to low risk. Primary care doctors may be able to handle PE without hospitalization safely and effectively. Why does it matter? Because your primary doctor may be the one who saves your life. And they're actually already doing that in many ways, but they're trained to identify subtle early symptoms, use risk stratification tools, start treatment, and follow you over time. They can also assess social determinants of health. Does this patient have a safe home environment? Are they alone? Can they monitor their vitals? Do they understand their medications? One family physician put it perfectly. Having a PCP is critical, not just for diagnosis, but for the entire care plan. So now let's discuss pulmonary embolus prevention tips. And here are my tips. On long car trips, stop every 1 to 2 hours, get out, stretch, and walk around. On long flights, stand up, walk the aisle, or do ankle and foot exercises in your seat. After surgery or illness, get moving as soon as your doctor says it's safe to do so. Even small movements help. Stay hydrated. Drink enough water, especially when traveling or recovering. Use compression stockings. If your doctor recommends them, then please use them as they help improve circulation in your legs. Know your risk. Talk to your doctor if you have pain in your calf, and especially if you have a history of clots, cancer, family history of clots, or other risk factors mentioned earlier. And if you don't have that history but have a persistent calf pain that can't be explained by overexercise and doesn't go away, please talk to your doctor. It may be just a calf strain or it may be a DVT, and seeing your doctor promptly may save your life. So in summary, pulmonary embolism is one of the most dangerous conditions you've probably never thought about, and it can strike without warning. But thanks to modern medicine, it doesn't have to mean a hospital stay or a death sentence. If you have traveled long distances or feel unusual leg pain or breathlessness, speak up and let your PCP know. It may save your life. Thank you so much for watching. Until next time, bye-bye.